Good afternoon. My name is Jenkins, and today we'll be discussing the Glasgow Coma Scale and also demonstrating proper assessment techniques utilizing Glasgow Coma Scale and incorporating the Glasgow Coma Scale, or GCS as it's called, into a full neurological assessment. At the end of the discussion, the student should be able to define what the Glasgow Coma Scale is and does. The student should be able to discuss the three portions of the Glasgow Coma Scale. And the student will be able to perform a proper assessment utilizing the Glasgow Coma Scale. So what is the GCS? GCS is a standardized objective assessment that defines the level of consciousness of a patient. It does not measure the severity of a concussion, nor does it measure cognitive abilities such as memory, short-term, long-term memory. GCS was developed in 1974 by Teasdale and Jeanette, a pair of neurosurgeons from the University of Glasgow in Scotland. Hence, that's where the name Glasgow Coma Scale comes from. It was originally utilized to assess level of consciousness after a head injury. However, today it's used by first aid, EMS, nurses, physicians, all to address acute medical patients, acute trauma patients. So the use of the Glasgow Coma Scale since 1974 has evolved. One of the big advantages of the Glasgow Coma Scale is that it's standardized. And you know, in medicine, when we're discussing a case with another provider or a nurse or a paramedic, sometimes the language isn't always standardized. This way, if you're communicating with another discipline or you're communicating with a facility across the country and you say, I have a Glasgow Coma Scale of 12, E3, V4, M5, for example. That tells exactly what's going on with the patient. The three portions of the Glasgow Coma Scale are best eye-opening response, best verbal response, and best motor response. The eye-opening response has a scale from 1 to 4, 1 being non-responsive at all, and 4 would be opening eyes spontaneously. Best verbal response section is from 1 to 5, 1 being no response, no verbal response at all, and 5 being persons wide awake, oriented to time, place, and person. The best motor response is a scale from 1 to 6, 1 being no response, 6 being obeys commands. So the highest total score you can get in the GCS is 15. 15 would represent someone who is awake, follows commands, has no problem verbalizing, has no problem moving any extremities or anything like that. A person with a GCS of 3, that's the lowest you can get. Now remember, this scale doesn't start at 0. It's 3 to 15. So the lowest anyone can be is 3. So someone who is dead has a GCS of 3. Someone who is totally unresponsive, you cannot get any response, either eye-opening, verbal, or motor response, is also a 3. The scale is a good predictor of mortality. If someone scores an 8 or less, that is a high predictor of mortality. In fact, 70% mortality rate or chance if a person scores below an 8. Greater than an 8, on the other hand, has a 90% chance of survival rate. So it is a very good predictor of mortality. Okay, now we're going to move into the assessment portion of this lesson plan. And in the assessment portion, we'll demonstrate the techniques. We'll also get into a little bit more in depth on each of the three components, the eye-opening, the verbal response, and the motor response, and specifically talk about how we rate each one of these or how we score each one of these. So let's move on to the assessment. Okay, so here we have a patient who presented to the emergency room with after falling off her bicycle and complained of head injury. Okay, so I'm going to do an assessment incorporating the Glasgow Coma Scale into her neurological assessment. Now this is just one part of her neuro assessment. So I'm going to wash my hands, don my gloves before I enter the patient's room. So I've done that. Now I walk in, and I'm going to get a little history from her. Hey, Miss Scarborough, how you doing today?
Okay.
Hey, so what brings you in the emergency room today? What happened?
Oh, well, I was being clumsy, and I was riding my bike, and there's a little dog that ran out in the street, and I was trying to do two things at once, trying to get the dog to steer them up onto the sidewalk to keep them safe while trying to get out of the way myself, and I just wasn't paying attention.
Okay.
There's a little high curve there, I kind of hit it, fell. No, I was not wearing my helmet.
Aha, okay.
And I hit my head.
Okay. Do you know where you are now?
Yes.
Okay. Can you tell me where we are?
I'm in the hospital emergency room here in Biloxi.
Okay. Good. And what year is it?
2016.
Okay. Good. Can you do me a favor? Can you just raise your left hand for me? Okay. Good. Okay. So, in this scenario, she scores normal on all three phases for eye-opening response, best verbal response, and best motor response. So as you can see, when I walk in, her eyes were already open spontaneously, so she scores a maximum score in that category of 4. Best verbal response, she scores the maximum in that category of a 5 because she was oriented to time, person, place, she knows what's going on. And best motor response, she scores the max in that category of 6 because she obviously obeyed commands without difficulty. So in this instance, she has a GCS of 15. And just as a reminder, GCS of 13 to 15 could be for mild brain injury, 9 to 12 is moderate brain injury, and 8 or less is severe brain injury. Okay, so we're going to change it up a little bit to offer a different representation of someone who may not be a 15 on the GCS. So again, let's just start the scenario over. I wash my hands, I don my gloves, I come to check on my patient in the emergency room, and I walk in, her eyes are closed. So I may just clear my throat or make some noise over here a little bit just to see if she opens her eyes. Still no eye opening. So next I'm going to move on to verbal stimuli. Miss Scarborough, can you open your eyes for me? Again, I will do it louder. Miss Scarborough, can you open your eyes? And there we go. Hey, how you doing? My name's Bodie. You're in the emergency room. Do you know what happened to you? You're doing fine. You were in the emergency room. Do you remember what happened at all? Or why you're here?
No.
No? Okay. Well, you had a little accident. You had a spill on your bicycle. Okay. Do you remember that at all?
No.
Okay. All right. What year? Can you tell me what year it is?
2012.
Okay. And how about your name? Can you tell me your full name?
Libby.
Okay. And your last name?
Scarborough.
Okay. Good. Good. And who's the president?
Reagan.
Okay. All right. Close. All right. So now we're going to look at the motor response. Can you shake my hand? No. Can you shake my hand at all? No. Okay. So if they don't respond for the motor, if they're not obeying command, next we can do painful stimuli. Now there's central painful stimuli and peripheral painful stimuli. Depending on what literature you read, recommends one or the other. That seems to be open for debate in the literature. There's also different ways to initiate the painful stimuli. One of the common methods is a sternal rub, where you put your fingers into the sternum and you rotate with some pressure, just to obviously for pain, to see if they react to that. However, some literature states that it's not recommended, even though it's kind of the standard, because there's potential bruising. Another one is supraorbital pressure, where you put pressure right there and under their above their orbit. Again, if they have facial swelling or trauma, you don't want to do that. Third one that I like is the trapezius muscle squeeze. So in this instance, you just kind of take the trapezius muscle about an inch down and just give it a little squeeze, and it's quite painful. We'll see if she responds to that. Miss Scarborough, I'm just going to pinch your neck a little bit here and tell me what it feels like, okay? See, she's pushing away. So she's localizing to that pain. So in that instance, she's localizing to the pain. She's going to be 5 on the best motor response. So let's review. The GCS assessment portion of her neuro exam is done. Her eye-opening response was not spontaneous. but it was to loud speech, so she gets a 3 on that scale. The verbal response, she was not alert and oriented. However, she was verbal, she was just confused, so she would get a 4 in this instance for the best verbal response. And best motor response, again, not max because she wouldn't follow commands, but she did localize to the pain, which was a 5. So if we add up the scores, in the eye opening is a 3, best verbal is a 4, best motor is a 5, 7 and 5, she scores a 12 on her GCS in this instance. So, we demonstrated a normal GCS, we demonstrated a not normal GCS. Now they can get lower and lower. If they don't respond at all, they wouldn't score anything in that category. If they are decorticate or decerebrate, again, they would score less, depending on how they reacted. So, we're going back to the Miss Scarborough who just fell off her bike, the first scenario, who was fine. We're going to be, doctor is coming and seeing her, is going to discharge her. As a nurse, I would come in and go over the discharge instructions with her. Now, part of the education with this client would be safety. Okay, so in the discharge instructions, I would really emphasize safety, safety, safety. You only have one brain. So education would be to, if you're doing any type of physical activity where you may get hurt, if you're riding a bike, if you're riding a skateboard, anything like that was a potential for a head injury, please, please, please wear your helmet. Okay, and that's about the best education and patient teaching we can deliver for this scenario. So, hope you enjoyed the presentation, and thank you.